Welcome, everyone. Good morning, good afternoon, and good evening, wherever you're calling from. My name is Grace Kistner. I'm a member of the Alliance of Nurses for Healthy Environments, and I also serve on the board of directors for the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. I also chair their UN committee. It is truly an honor to be here to open this session with all of you today. This moment is both a continuation and culmination. We launched this work together at CSW 69 last year, and through our webinar series, Nurses Leading the Charge, The Path to COP30, we brought together a global community of nurses to better understand what climate change is, what its health impacts are, and how to engage meaningfully in global policy spaces like the UNFCCC and its Conference of Parties. But more than that, this initiative was about shifting identity from nurses as responders to climate-related impacts to nurses as leaders shaping solutions, systems, and policy. And that is exactly why we bring this conversation here to you today at CSW 70, because climate change is not only an environmental issue. It's a health issue, a gender equity issue, and a systems issue. And as the largest and most trusted health workforce globally, predominantly women, nurses are uniquely positioned to lead at this intersection. Advancing gender equality means transforming systems, and today we are talking about transforming climate and health systems through nursing leadership. Over the past year, that leadership has moved from virtual spaces like this into global action. Nurses from our community showed up at Brazil at COP30, and not just as observers, but as advocates, innovators, and contributors to global dialogue. Through our collective work and a global social media awareness campaign, we amplified the voices of nurses driving climate and health solutions around the world in their communities. Today's session is about reflecting on that journey and, more importantly, translating it to what comes next. We'll begin with opening remarks from Howard Catton, representing the International Council of Nurses, grounding us in the global perspective of nursing leadership. Then we'll also hear from Nanny Santana, who will walk us through the Belém Health Action Plan, an important outcome of COP30 that connects directly to health systems, equity, and implementation. Following that, Milena Sergeyeva will provide a COP30 recap, helping us understand that broader landscape and what was achieved. We're also going to briefly talk about the Annie and Sanciel partnership and the outcomes of this initiative that we had, including how nurses engaged, what we learned, and how this work has evolved. Then we're going to move into the heart of our session, a panel of nurses, delegates that were on the ground at COP30. These nurses are working across clinical practice, academia, policy, and global health. And they'll share not just what they experienced, but how they navigated those spaces, what impact they saw, and what it means for all of us moving forward. This will be followed by breakout conversations where you're going to have the opportunity to engage directly, ask questions, explore how you can step into this work, and whether that's through advocacy, innovation, or participating in global forums. So as we begin, I invite you to think about what your role is in this space. Not whether you belong in climate and health conversations, but how you will show up in them. Because if climate change is one of the greatest threats to human health and equity, then nursing leadership is one of the most powerful solutions. So let's go ahead and get started. And I want to welcome Howard Catton.
Grace, thank you so much for your introduction. Good morning, good afternoon, good evening to each and every one of you. On behalf of the International Council of Nurses, please let me extend our sincerest thanks to the Alliance, to Soncel, and to all of you who are on this call, who've been participating in the debate, in the advocacy, those of you who are in Brazil as well. I have no doubt that what we have seen from ICN over the last 2 or 3 years, you have been really effective, done a fabulous job in terms of raising the visibility of nursing and the impacts and implications and consequences for health more generally. And I genuinely want to thank each and every one of you for that, and give a shout out to my colleague Gila Gdansky, who you will hear from later on this call, who has been central to helping that happen from ICN and working with all of you. Listen, I think we all know that we are at a moment of great change, uncertainty, and risk for our world as well. We seem to be moving away from a an established order, of a rules-based order, of a multilateral approach to one where the strongest and the mightiest are dominating, and issues which are of concern not just to us and our profession, but indeed to the planet in climate change, we see receiving significantly less attention, noticeably being relegated down the world priority order of things to do, issues to address. I saw that very directly myself at Davos this year. I was there for a short period of time, engaging in some of the side events and debates on nursing and on health issues, as you'd expect. But there was very little that I saw on the agenda that related to health, and nothing in relation to climate change. For understandable, for obvious reasons, though we don't clearly agree with those. But let me not be too negative about that, though, because there were issues which were featured significantly, that not just the politicians, but the leaders of industry and companies who were attending Davos wanted to talk about in relation to technology, issues around equity, and of course, always economic impacts, economic benefits. And it struck me very much that through those other issues are very clear links and relationships that we must and need to join the dots to in relation to the role, the contribution of the nursing profession and the impacts on health as well. So it's a difficult time, it's a challenging and it's an uncertain time. But there are, I think, approaches and strategies that we should be pivoting to and looking at, and that we can leverage and that we can use as well. And one of the most powerful ways that I see time and time again to make a real impact in terms of an intervention or raising an issue or joining in on a debate or even offering a criticism is when we bring the real life examples of the impacts that we as nurses see of climate change on people's health. Nurses can speak with huge authority, power, and authenticity about what they see happening to the people that they care for. Obviously, that's often, very pronounced and very obvious when you're talking about a disaster, a climate-induced disaster, and someone's lost their home, they're suffering traumatic injuries, there are mental health implications, there are migration of populations, and all of the health issues that flow from that as well. But outside of the disasters, nurses are also seeing people who are living with chronic conditions, but struggling because of changes in weather and extreme events, and not wanting to go outside, maybe not socializing, having to change their medication, issues around food as well, and exercise, huge and linked to climate, as we know as well. So our potential impact and power from the stories, the real life stories that we have and that we tell, don't just relate to the
same old.
Obvious impacts of climate change. They then mean that our voices are hugely important in relation to recovery and to preparation as well. And I see that in the work that you have all been doing. I think, Grace, you said something at the beginning as well about the trusted voices of nurses, and I think that we should never lose sight of that either. One of the other great challenges we face now clearly is a loss in science, the spread of misinformation as well. We see corporate takeovers and capture some of the big global events like COP as well. Well, we're a 30 million strong profession with the most trusted voices. And I think that we have great opportunity for nursing capture as well of these debates that you will be at the forefront of. And never forget that the trust that patients and the public have in us come from the ethics on which our practice is based. And ICN's Code of Ethics speaks directly to issues around climate justice, climate change, the impacts of health as well. So as challenging as this moment is the importance of the work that we're doing together, your work, your advocacy, your leadership has never been more important. But I believe, for all the reasons I've said, you are, and you can, and we can continue to make a real impact to shift the decisions that are being the decisions that are being taken and the choices that are being made as well. I'll look very much forward to hearing many of your contributions as well during this webinar. Thank you very much. Back to you, Grace.
Thank you so much. And now I would like to call in and welcome a powerhouse, Nani Santana, Technical International Affairs Advisor for the Brazilian Ministry of Health and the Pajo region of the WHO. Nani, please come off mute.
Oh, thank you so much for having me. It has been great to listen to your perspectives. I'm going to share a presentation on the Belém Health Action Plan to help contextualize it. Just bear with me for a second. Okay. So the Belém Health Action Plan was Brazil's proposal for the action agenda during COP. The action agenda happens outside of the negotiations. It's for actors that are willing to implement initiatives that could help advance on climate action. And in this sense, last year, the action agenda had 5 pillars, one of which was human and social development, and one of its main objectives was promoting resilient health systems. Under this mandate, here, the Ministry of Health of Brazil has developed the Belém Health Action Plan as a proposal for countries to endorse under a voluntary framework with the goal to advance on health surveillance, technological innovation, and to strengthen multisectoral policies to deliver on more resilient health systems. So in this sense, the plan considers the diverse needs and national contexts of health systems around the world, and that we need to have cross-sectoral collaboration to accelerate both on mitigation and adaptation efforts to generate health co-benefits. So we understand that tackling the effects of climate change involves actors not only from the government, but from the medical profession. So for nurses as well, we want to have civil society. We want to have international organizations, philanthropies, multilateral development banks, all working together to develop and implement adaptation policies that will help the health sector adapt to climate change. So the plan is structured around 3 action lines. The first is surveillance and monitoring, which includes improving climate-informed health surveillance, because we need to be working on a multi-sectoral way that includes data that the climate sector can offer to us to improve our surveillance. It also has an action line focused on evidence-based policy strategies and capacity building. Under these action line, there are 2 proposed measures that I think are really relevant for nurses, which are protection and promotion of workers' health in the context of climate change and strengthening the health workforce to address climate change challenges. And action line 3 focuses on innovation, production, and digital health. So this action line seeks to improve access to technologies that can help the health sector adapt. It means strengthening its resilience and infrastructure so that when we have extreme weather events, healthcare services can continue uninterrupted. It also means strengthening stockpiles and enhancing the resilience of health supply chains. And the cross-cutting principles of this plan are enhancing health equity and climate justice, which means that adaptation needs to consider the differences that can be socioeconomical, ethnic, racial, in when the adaptation policies are developed so that they can be effective considering the different contexts, and also leadership and governance with social participation, which means that when we are developing health policies, we need to have the participation of different sectors of society so that the outcomes can be implemented by different actors, but that we also have them participating at every stage of policy formulation. So for everything that we are proposing on this plan, we need to have these health equity lenses in mind. Regarding the relevant measures that could be implemented into nurses' practices or that we can have more nurse engagement, we have highlighted the measure on protect and promote workers' health in the context of climate change, which includes having evidence-based regulations and policy interventions that consider the impact of climate change on the work environment. We know, and has was mentioned here today, that nurses are on the front line of climate emergencies. So this has a direct and indirect toll on the physical and mental health. And when policymakers are developing adaptation policies, it also needs to have interventions that will provide psychological care for the healthcare workers that are attending to the public every day. We also are proposing surveillance for workers' health, which means having local and regional workers' health teams. So it's more on the angle of occupational health to cover and provide for formal and informal workers. And we also propose multi-sectoral engagement and in coordination among public sector entities to have adaptation policies that implement safety standards. And on the angle of strengthening the health workforce to address the challenges of climate change, we proposed having technical capacity building for the health workforce to address these impacts, regularly updated training programs, and these can include environmental health and climate change training for nurses. We also proposed to integrate environmental and climate change related content into health education to better prepare the workforce to deal with these challenges. This can include knowledge exchange through peer learning and mentorship, interdisciplinary programs that include indigenous and traditional knowledge, because as the healthcare workforce is working along different countries, regions, and there are communities that have specific needs, we understand that health education should include this context to prepare the professionals to deal with these challenges. So just for your perusal, these are the countries that are currently endorsing the Berlin Health Action Plan right now. But our efforts to gather more countries to support this plan are ongoing, and we hope that the association can engage with the government of these countries because they now have a commitment to promote the health sector adaptation and to consider the healthcare workforce as one of the main agents that can help with the implementation, but that also need to be protected during this process. And here are the outcomes of the health day. So everyone that was present on that day, and a little bit of context for you because I know my time is ending. So the plan is the first international climate adaptation plan dedicated to health. We had a total of endorsements, and there was the announcement of the Climate and Health Funders Coalition to implement $300 million to advance on the implementation of the Berlin Health Action Plan. And we are very happy to have actors like you engaging with the content of the plan because you are very needed to advance on implementation and to further the adaptation of the health sector. Thank you for hearing me today.
Thank you so much, Nani. What an amazing effort. And thank you so much for your continued work that you're doing today on that. Next, I would like to call in Milena Sergeyeva, Networks and Engagement Lead from the Global Climate and Health Alliance, who helped to coordinate and keep all of us up to date on the ground in Belém. Welcome.
Thank you so much. I'm just going to share my screen. That is hopefully visible. My name is Milena Sergeyeva. Thanks for the warm welcome. I'm the Networks and Engagement Lead at the Global Climate and Health Alliance. The Global Climate and Health Alliance works at the forefront of a growing global movement of health professionals and health and development organizations dedicated to promoting a healthy, equitable, and sustainable future for all. We address the climate crisis through evidence-based advocacy, policy, movement building, research, and strategic communications. We have over 250 organizational members from every region, and they're reaching over 125 countries. The Alliance co-chairs the WHO Civil Society Working Group on Climate and Health and collaborates with organizations and agencies around the world to ensure that people's health is protected in the climate crisis in national, regional, and international decision-making.
Milena, sorry to interrupt. If you're sharing slides, we can't see them. Or if people see.
Really?
Oh, now we can. I'm sorry. Can people see those? Yes, they're up. Thank you.
Oh, thank you so much.
See a slide. I'm not sure if you've advanced yet.
Is
there,
it
that's working.
now?
Yeah.
Great. All right, so I'll tell you a bit of history of the health movement at climate conferences. Health has been getting more and more attention within the climate conferences thanks to the joint efforts of the Health Civil Society and the World Health Organization. Over the years, GCHA members such as International Council of Nurses and the Alliance of Nurses for Health Environments have taken pivotal actions together using the trusted voices of the health community to call for health protective climate action, and we are forever grateful for your commitment and your engagement all the way through. GCHA itself was created in 2011 at the COP in South Africa, and since then it first organized climate and health summits outside of the negotiation space and sent small early delegations at COPs. Since well, at the COP21 in Paris, where the Paris Agreement was adopted, there was a big health declaration representing 13 million of health professionals, and it called for the right to health to be embedded in the Paris Agreement, which it was. And another milestone is the first ever special report that was delivered by the World Health Organization to the COP presidency, and it was commissioned by Fiji, the presidency of Fiji. COP26 then saw great engagement from the health community and a ramp up of activities on health with the first health pavilion, which hosted by the World Health Organization, and the Wellcome Trust, which since then has had full 2 weeks of events on climate and health at Blue Zones. The WHO Civil Society Working Group and GCHA organized regional consultations before COP this year. And it provided inputs for the new special report on climate and health, which was delivered to the COP presidency. And health professionals arrived to COP26 with a healthy climate prescription letter representing 46 million healthcare workers around the world. The UK COP presidency developed a whole program on health and climate, which included the launch of the Alliance for Transformative Action on Climate and Health. In Egypt, the final decision included the right to clean, healthy, and sustainable environment, and health was established as a cross-cutting theme in the global goal on adaptation, which measures how we are progressing to adapt to this climate crisis happening. This slide looks a little full because at COP28, we saw a record number of health professionals attending, including 50 ministers of health, We had the first Health Day and the Ministerial Declaration on Climate and Health, which was signed by health and environment ministers. It mentions intersectoral climate action for health. And at COP28, also guiding principles for health and climate financing were adopted. A big win for climate and health is from this COP was the inclusion of transitioning away from fossil fuels in energy systems in the global stocktake, which was the final decision of this COP, which tackles the root cause of the climate crisis and so many other health impacts related with the different activities of the fossil fuel industry. And however, for health to be a real accelerator for climate action and in order to minimize climate impacts, we need to have health considered in a cross-cutting way across all of the negotiation tracks. And this is what we have been doing together with the health civil society for the last few years. GCHA has coordinated a wide civil society policy group that works all through the year to develop the recommendations for negotiations and really follow the developments during the year and adapt the recommendations and also bring them to negotiators and decision makers at different stages of negotiation to reinforce the ambitious climate action with the health arguments. And we have been, we are together increasingly knowledgeable in climate negotiations and becoming experts in advocacy and using this trusted voice. We, at COP30, as Nanny mentioned, we saw the adoption of the Belém Health Action Plan, but also we brought the wider health community recommendations for negotiations, and we saw also an effort from Latin America and the Caribbean developing a joint position on climate change and health. And we also had a health march on the streets of Belém, Health and Climate March, which was joined by some nurses I see on this call today. So I won't touch very much on the Belém Health Action Plan. We heard about it. There was a new special report by the World Health Organization, and countries had to deliver their new climate commitments last year. So we saw some countries pledge on new action on black carbon, which is really important for health. In the final decisions of COP30, we saw the human rights to health and to clean, healthy, sustainable environment mentioned in the Mutirão decision, which is in an indigenous language from the Amazon, a common effort. This decision acknowledges the economic and social benefits and opportunities of climate action, including economic growth, job creation, improved energy access and security, and improved public health. It reaffirms the doubling of adaptation finance by 2025 and calls for efforts to at least triple adaptation finance by 2035. On the global goal on adaptation, which was a decision that was very much awaited, a considerable group of health experts had been working for 2 years on a selection of indicators to measure progress in each country on adaptation. In the end, we saw a different process. The COP30 presidency proposed indicators which were adopted, a different set of indicators. So now there is a new process needed so that these indicators are aligned to national policies everywhere around the world. And this program of work will end in Ethiopia at COP32. I will rush through as I don't have much time. In the just transition space, we saw the right to health and the right to a clean, healthy, and sustainable environment in both the preambular and operative paragraphs. We saw the inclusion of care economy and social protection, and the need for scaling up access to clean cooking, highlighting the many co-benefits of clean cooking in terms of health, gender equality, the environment, and livelihoods. And in the gender negotiation space, there was a gender action plan, a 9-year plan adopted, which looked to increase knowledge in emergent issues like sexual and reproductive health and rights, gender-based violence, and unpaid care work in the context of gender and climate change. I will end by saying that the results are very hard to obtain. We're facing a multifaceted challenge, and often we're very disappointed, but there is thankfully an ever greater interest from health organizations and from each and every one of their members, and a strong commitment and engagement and a resilience, and also the acknowledgement of the importance to work together and care for each other. And we're very thankful for our final efforts this year have been focusing outside the UNFCCC, as we didn't see the expected results of the roadmaps for fossil fuel phase out and halting deforestation. So now the presidency has invited interested stakeholders to provide inputs for these roadmaps, and we're working on them. And there is also this process outside the UNFCCC, the Santa Marta Conference, the first one, and we are hoping to engage together with all of you to help shape the transition and include health considerations there. And thank you so much for the attention.
Thank you so much, Milena. GCHA's leadership in this area is so critical for the climate and health community. So thank you for joining us today and for your leadership in this area. I just want to again thank Howard, Nani, Milena for really providing the foundation for this webinar, why we're here for this discussion, and providing a recap of everything that happened the past year. My name is Kara Cook. I'm the Deputy Director with the Alliance of Nurses for Healthy Environments, and I'm going to provide some additional context to this this session today, as well as kind of shift us into more of the interactive portion of the event. So as Grace had mentioned in the beginning, SunCL and Annie partnered. Actually, we launched a year ago at CSW, a CSW event in which we made the announcement that we had this partnership and we were going to be hosting a COP30 series focused specifically on the actions of nurses relating to climate change. So we had, throughout last year, we had a 7-part webinar series which led up to COP30 in Belém. In addition to the webinar series, because one of the goals was to raise awareness and education for nurses about the COP process, as well as the way nurses could engage at COP and beyond. We also wanted to showcase the voices of nurses. And so we have, at the end of the series, we hosted a social media challenge in which we asked nurses to share videos and images of them and provide a brief quote about how they were taking action, whether that be participating in COP or just action within their practice settings. And I wanted to report back on that campaign. It was incredibly successful. We had about reached nearly 8,000 people, and we had about a little over 11,000 in engagement, which is really great for a campaign like this. And we noticed that people were really interested and engaged with the on-the-ground content. So we had nurses who attended COP who took a quick selfie video and shared their experience, and that those posts got a lot of engagement. And I think that just really showcases that People are looking for nurses to lead in these spaces, and nurses are ready to step in those spaces. And I really loved Howard's comments about let's have nursing capture. And I love that nursing and health capture of these processes because it's so critical that we're elevating the health connection in these conversations. So without further ado, I'm going to move us into our panel presentation, and I'm going to introduce our moderator for the session, who will then introduce our fantastic panel of speakers. So first, I will introduce Dr. Gil Adinsky, who is the Senior Policy Advisor at the International Council of Nurses. Dr. Adinsky is a doctorally prepared researcher with expertise in global health workforces, health policy, and health system strengthening. We've worked very closely with Gil, who has been a great partner in our climate change work with ICN and who was also on the ground at COP. So I will turn it over to Gil to introduce our panel.
Thank you so much, Kara, and thank you so much, Grace, as well, for planning this incredible session. It's such a pleasure to be moderating. As Grace said, I'm a senior policy advisor at the International Council of Nurses, and I've had the pleasure to have climate in my portfolio. Right now, we're also celebrating CSW, and as nurses, we really know those links between climate, health, and gender equity, and how interconnected all of those themes are. And as a women-dominated profession, we know that it will be those female nurses on the front lines of all of the climate disasters and health surges that we'll see as climate change continues to progress. So it's really important to have this advocacy today. I'm really looking forward to sharing our panel today. I'll introduce them and then I'll give them a brief chance for them to introduce themselves and why climate is an important topic in what they do. So first we'll have Millie Elia. She is the manager for the climate and clean energy advocacy at the Alliance for Nurses for Healthy Environments. Aaliyah, do you want to come in first and briefly introduce yourself, and then I'll introduce the next panelist as well?
Yes, thank you so much, Gil. So my name is Milagros Elia. Everyone calls me Millie. As Gil said, I am the program manager of climate and clean energy advocacy here at Annie. And my background is as an oncology nurse practitioner. One of the reasons that COP was so meaningful for me was to see that nursing voice really coming up in COP 30, offering that health expertise to climate policy decisions. Thank you.
Thanks, Millie. Next, we'll welcome Kat Kruger. She's a registered nurse and nurse practitioner scientist at the University of Michigan with a strong commitment to advancing global health systems resilience and nursing leadership. Kat, you want to come in and introduce yourself as well?
Yeah, thank you so much. Hi, everyone. Thank you for having me. My name is Kat Kruger. I'm an emergency nurse practitioner, and I'm a researcher at University of Michigan. And my research really focuses on understanding how the global nursing workforce can and should be utilized as a key climate adaptation strategy. Thanks for having me.
Next, I welcome Dr. Sue Bell, who is a nurse scientist and family nurse practitioner whose work focuses on strengthening health systems and community resilience in the face of disasters and climate-related health risks. Dr. Bell?
Hi, thank you so much for having me. I'm a professor at the University of Michigan of nursing, and my nursing background is as an emergency nurse and nurse practitioner. I also am a member of a federal disaster response team where I respond to disasters across the United States. And my research really came out of working in disrupted communities and working in disaster response, where I wanted to try to translate the challenges I was seeing on the ground into research and policy-driven solutions. So that's what I do on a day-to-day basis now. Thanks for having me.
Thanks, Dr. Bell. Next, we welcome Dr. Connie Senter, Chief Representative to the United Nations for the League of Women of Women Voters of the United States. Her expertise span transcultural nursing, school health, sustainable development, and healthy aging across the lifespan. Dr. Sensor? Is Connie on?
Connie, you're muted.
Sorry. Good morning, everybody, and thank you for inviting me to be part of this. I feel like you're my extended family at this point because we've had connections for so long, and I'm going to emphasize some of that later. But I guess my background, Gil has already talked about, but one of the things I'm just going to bring it down to a very basic level. When I talk to nurses and I say, get out of your comfort zone, but truly, if you are taking care of someone where the environment or the climate has made them sick and they're in your ICU and you treat them and you send them back to that same community or environment that has made them sick, what have you done? Really. So this is why nurses should care. You need to be able to advocate in your communities. You need to be able to raise awareness. And that's down to the very basic level of thinking globally and acting locally. So over back to you, Gil. Thank you.
Thanks, Connie. And last from our panel, but certainly not least, is Linda Coe. She's an assistant professor at the University of Massachusetts at Amherst, at the College of Nursing. Her research focuses on sustainable plant-based nutrition interventions for health promotion and chronic disease prevention through community-based teaching kitchens and farm-to-school programs. Linda, you want to come in and introduce yourself as well?
Hello, everyone. Thank you for the opportunity to be here. It's nice to see all of you. My name is Linda Coe. I'm an assistant professor in the College of Nursing here at UMass Amherst. Thank you so much for the opportunity to be here.
Thanks, Linda. And our first question today will actually be for you. So we are curious what were your expectations going in, and how did the actual experience at COP compare to your expectations? We're curious about what is one myth about COP that you would want nurses to stop believing.
So, thank you for the question. Going into COP, I wasn't really sure what to expect. I had first heard about COP back in 2009 when I was doing an internship in Copenhagen, Denmark. It was focused on development and relief and public health. And so I had heard that there was this opportunity to possibly go. So I was looking forward to it, but unfortunately I wasn't able to make it. So it was kind of in the back of my mind. And I ended up joining a group through the American Nurses Association Innovation Advisory Committee, and it was focused on planetary and global health. And so that's where I met Casey Belgard and Millie. And so they shared their experiences about how they had gone to COP in Egypt and also Azerbaijan. And I thought it was just fascinating that nurses could be involved at COP in this way. And so I was thinking, how could I get involved? Like, what could I do? And so I started looking through some of the things that were coming across from the Alliance of Nurses for Healthy Environments. And I heard from Kara about the opportunity to possibly go to Brazil. And so I was always fascinated by the Amazon rainforest. And so I was like, oh, this would be my opportunity maybe to get involved and go to COP. So I didn't really know what to expect. And so when I got there, I was looking to see like what ways I could get involved or what was out there for nurses that were just starting out. And so that was my initial interaction with COP. In terms of maybe like preconceived ideas or myths that I had going in, I think I thought that the people that went to COP were mostly like in leadership positions in government, like delegates, government officials, world leaders, and I didn't really see a way that a nurse could get involved, especially being at that point back in 2009, I was still doing direct patient care. So I think now that I've moved into academia, it's been really exciting to see the things that I learned at COP and being able to take those ideas and share them with the students that I interact with on a daily basis, as well as in the community. So thank you for the question.
Thanks, Linda. I think a sentiment you said there that's going to relate to a lot of people on that call, on this call, is that idea of what can I do and how can I go get involved. And I'm so glad that you shared that that was from your direct patient care experience as well, because that's the stage of our career where we're seeing the issues the most, but can feel the most helpless. But I think there are so many ways that we can find something to do, and I applaud you for going out there and finding it. It's so impressive. My next question is going to be for Kat. So Kat, how does in-person participation at COP strengthen advocacy, partnerships, and visibility for the nursing profession? And how does that translate into tangible outcomes? And if you have a specific example, we'd love for you to share it.
Yeah, thank you so much. That's a great question. So in-person participation at COP matters, but presence alone is really not enough. We really need to have strategic presence to really implement change in what's possible for the nursing profession. So we know that nurses are the largest health workforce in the world, and yet we're often underrepresented in these spaces. But by being physically present at COP, we can bring frontline credibility, live knowledge of community health impacts, and really the workforce perspective that policymakers often overlook. And we know that nurses will be the actors who primarily implement these policies related to climate and health, so we really must be helping to shape them. But presence without strategy or even intentionality can be really exhausting and ineffective. COP is overwhelming. There's thousands of events and meetings and conversations happening simultaneously. And what can turn presence into impact is really this intentional engagement. And it's actually something I've been talking about with my daughters a lot. And I think it also really applies here, is to really be big and to take up space. And so, really, the first step, I think, is simply recognizing our value in this space. Nurses belong here. We are experts. And so, being present at these high level events and using strategic networking can become a form of policy leverage. So, for example, some tangible outcomes for me that came from really small moments. For me, engagement with COP really included presentations with both nursing and non-nursing organizations. And in the moment, it can be hard to know whether or not these relationships can be lasting. And fortunately for me, they have been lasting. My experience at COP increased my involvement with both Annie and Sanciel. I'm now on the UN committee for Sanciel, and I continue to collaborate with Annie. And of course, I'm participating in fabulous events like this. And these moments in collaborations really accumulate over time. They strengthen the visibility of nursing as a policy actor rather than just a clinical workforce. And also, COP really helps validate your work. For me, before I participated in COP, I was part of a disaster research kind of networking group. And my initial impression was that they were kind of bewildered at why a nurse studies disasters and climate change. But after COP, the discussion shifted, and my presence at COP really validated my work. And now I'm doing a lot of research collaborations with them. And so finally, I'd like to share one more thing. Earlier this week, I was interviewing a global nurse leader for a research study, and she highlighted something really wonderful. She said that we often, as nurses, complain or lament that we don't have a seat at the table, and we can be guilty of waiting our turn or waiting for an invitation. But we are the right profession to be deeply engaged in this space. Nurses think in and navigate in complex systems daily. We're the most broadly distributed health profession. And so we know how climate change directly and indirectly affects health. So if I can share my big takeaway from COP, it's really that we should all be big and we should take up space. We belong here, and I encourage you to show up and communicate your value. Thank you.
Thank you so much, Kat. That was amazing. I completely agree that nurses need to be big. And I think the way we have even three organizations coming together on this call today, we can show how we are able to strengthen each other's platforms and make sure that nursing voice is big and united. That's exactly what we need to be doing in these global spaces. My next question is for Dr. Bell. Dr. Bell, nurses may not always see themselves as policy actors. How do you use your specific expertise, whether it's at the bedside or in your case as well in academia, public health, or administration, to influence climate action? And what is one sentence that nurses can use to connect their daily work to climate action?
Thanks for that question. So I want to flip the script and say that instead of nurses may not always see themselves as policy actors, ask a question instead. How can we help nurses see that they are already policy actors? And I think one way we can do that is through professional organizations like Annie, like SANCIEL, and like ICN. And I think through that participation in nursing advocacy organizations, we can help nurses to see what their power is or what their individual superpower is. And that might be being at the bedside, holding someone's hand through the worst possible time of their life. It could be at the hospital level, setting policy and setting new protocols that are addressing environmental and climate action. And it could be taking on a major leadership role with an organization where you're actually sitting at the table at COP, participating in the negotiations. I think there's space there for nurses at all levels to act there. And every single one of the things I've outlined is equally important. And I hope that like through this example, we also see that nursing is this complex system that we can work together, where we can value those nurses that are at the bedside and those nurses that are doing the negotiations at COPs. And I wanted to give myself as an example in my own work. My main focus is as a researcher, and I do research that I hope leads to policy change. So I focus on disruptions to health and healthcare from disasters, pandemics, and infrastructure failure. I already said, I also am on the ground in disaster response. And what I see, some of the biggest impacts to health are from that disruption are around continuity of care and addressing chronic conditions. People just want access to healthcare and to have their healthcare needs met. And so that on the ground experience helps me to think about research questions and turn those into research projects that I hope will turn into policy change. And that's how I view what my contribution is. Thank you so much for having me. And I also wanted to say thank you so much to Annie for the encouragement to come to a COP and hosting me there and helping me along while I was there.
Yes, we all wouldn't have been able to do it without Annie guiding us, for sure. You just hit on how nursing has so many different layers in which we address our issues. It goes back to that ecological model that we all learned in undergraduate nursing studies. But whoever is on this call, you all interact at one of these different levels of nursing, or you're a nursing ally who's supporting nurses to do that. So Dr. Bell really touched how wherever we are, whatever role we're in, we have a part to play in climate action. My next question, I can open it up to whoever would like to take it. For nurses interested in global policy engagement, how can professional organizations and advocacy networks serve as an entry point into spaces like COP? And what did being part of a larger community enable you to do that you might not have been able to do alone?
Gil, I'm happy to take that question.
Please, Millie.
Hi, everyone. So, getting into global policy spaces like COP can really feel, as my colleague said, intimidating at first. And where do you really start, even as a nurse? And remember, I mentioned that my background was about 30 years of a mainstream oncology nursing as a nurse practitioner. So this is a world away from where I started. And that's really where professional organizations and advocacy networks make such a big difference in helping, clinically based nurses transition. They really act as your entry point. So these groups, such as Annie, such as Sonciel, and others, already have relationships, credibility, and access to spaces that would really be hard to navigate by oneself. I know it was hard for me. So instead of trying to figure out everything on your own, you're now making that choice to step into a community that's already engaged, whether that's through official delegations, side events, or policy discussions. And I think that it's even more powerful. What's even more powerful is what being part of a larger community actually enables you to do. So for me, it wasn't that I was just showing up as one individual voice. I was part of a collective. And that gives your message, my message, more weight. It opens doors in collaboration, mentorship, and real time learning from people who've been in these spaces before. It also helps to create opportunities you might not have access to otherwise, like speaking on panels, contributing to policy statements, or really just being in the room for critical conversations. Alone, that can be really hard to achieve. And my last thought on this is, but together as a network, you're not only amplifying your own voice, you're helping to elevate the role of nursing in global climate and health policy overall. And that's really our goal, right? Making sure nurses are seen, heard, and actively shaping these decisions. Thank you.
Thanks, Millie. Yeah, we couldn't agree more at the International Council of Nurses, being a professional organization ourselves. And it's so great to have so many other ones on the call today. You really can stand on the shoulder of giants when we all team together. I know my organization is from the 1800s even, founded by women suffragettes. So we're standing on all of those nurses that came before us, and standing with all the other nurses advocating today when we interact in those professional organizations. My next question will be for Dr. Sensor. How was attending COP concretely changed how you practice, teach, research, or lead? What is one change, however small, that you implemented after returning? Connie, you're on mute again.
Thank you for the question. I just wanted to emphasize how important it was what Millie said, what Milena said, what Nanny said about us all coming together, right? And I use my relationships with professional organizations like ICN, like Sancia, like Annie, to gain information in a collective way and fact-checked information that makes it easier to have those discussions and to use those examples. I think there was one kind of paragraph that put it together in terms of storytelling and to emphasize with students and with the public just that storytelling is such an important part of this. So I just wanted to share that piece, that think of how powerful this one paragraph is. And if you could use it over and over again in different ways to connect it to a story in a personal way. But pregnant women exposed to fossil fuel pollution, this is how fossil fuels damage human health at every stage of their life cycle, right? So pregnant women exposed to fossil fuel pollution face higher risks of preterm birth, low birth weight, and congenital abnormalities. Children exposed to air polluted by fossil fuels suffer more asthma, respiratory infections, and developmental harms. Adults face increased rates of cardiovascular disease, respiratory disease, cancers, kidney and liver damage, and neurological conditions. And even after extraction sites and refineries close, their toxic legacy continues to poison air, soil, and water for decades. And all of these cumulative diseases then put increased stress on the workforce. So I think that when you can emphasize any of these in your curriculum and say, just this one sentence, weave it in. How does climate and environment affect human health? And this is an essential takeaway from COP. But the best part is that what everyone has emphasized, our collective presence amplifies our voice, makes us stronger. And I would always encourage people to belong to professional organizations or networks, and then take it one step further and think about policy and how you can influence policy with your vote. So I think voting is how the League of Women Voters ties into all of this. Vote for policies that promote health and protect our planet.
Thanks, Connie. And that segues really well into a question I'll ask all of the panelists, which is what is your biggest piece of advice for nurses who want to have an impact on the global level in climate action, since it's what we're talking about today, but also we're here for CSW, and this is a CSW event. So in gender equity and all of those other elements that intersect with both health and climate as well. I invite our audience members. You can start posting your questions in the chat because after this response from all of our panelists, we'll go to questions from the audience. One more time, that was what is your advice for people who want to make an impact at a global level? We'll go back to the top and start with Linda.
Thank you. I would say, going back to what Sue Ann said, looking to join an organization and getting involved that way, you can find all different activities. And then the second thing I would mention is to look at where you are currently situated and how you can get involved, maybe in a way that you haven't necessarily thought of before. I know a lot of times as nurses, we do different tasks, but we don't always think of the impact. And so when I was doing my postdoc, I was working with a farm to table camp for school age children from kindergarten up to 8th grade. And I was thinking, what are the ways I could maybe teach kids about sustainable food systems or about plant-based nutrition and the way it impacts health and also can be beneficial for global health as well. And so I created with a team and a graphic designer, we created a book, a children's activity book. And based out of that book, we've now received funding to translate it into 10 languages. We've created a quick guide for use in the clinical setting, and we're just finishing up a guide for teachers and parents that are wanting to use the book at home or in school settings. So just starting small and looking for ways to maybe expand from there. Thank you.
Thanks, Linda. And I believe we had Kat next to stick with the same order.
Yeah, I'll keep mine very kind of short and simple. I would say if you're waiting for an invitation to get involved in this space or lead here, this is your open invitation. Inject yourself into this work, and if you want to do it individually or you want to join the organizations who are already working in this space, just jump right in.
Amazing. And Dr. Bell?
I'm going to capitalize on what Kat said, just to add on to that, is to find, what really drives you. What are the issues that you see around climate and climate action that, stir you to action or that have affected you personally or that you want to invest your time in, and start there. I think looking at it as a whole can be overwhelming, but starting with, those small steps that you can take and build into something larger can help you feel like you're actually doing something and help you take action.
Thank you. And next we had Millie.
Yes, I'm actually going to bounce off of and echo what Dr. Bell said about it can be overwhelming, this space, and really honing in on your area of interest as a starting point. For me, two areas of interest, as using myself as an example, was really gender equity. Women are the most impacted in climate disaster events. We are 80% of migrants due to climate disasters are women. And who do women travel with? Well, we travel with our babies. So that's a very vulnerable group. And also another vulnerable group that has always been my interest is disabled, those in the disabilities groups. So how does this really manifest itself in those particular populations? For me, that was a key that opened the door to everything else. So I invite you to really look at what matters to you and how that fits in. Thank you.
Thank you. And last but certainly not least, Dr. Sensor.
Yeah, I just wanted to emphasize that, COP is a culmination of bringing people together, but the work continues year round. right? So there are places to look for consultations. UN Web TV has archived briefings related to climate. My first COP, I went to every event Climate Week in New York in September to just meet people and to learn, where there were connections and where there were spaces. But then those opportunities start to open up. And so if you're looking on a regular basis, through things that are happening at the UN, you can see where there are opportunities for consultations or to belong to committees where you have input all year long. And then your expertise starts to become more recognized, and you get to be a spokesperson, you get to be invited into more spaces. So I would say look for those opportunities within committees way ahead of COP. The preparation for the next COP starts when COP 30 ends. We're preparing already for COP 31 and looking at, the what next part and where we feel that we need to put more emphasis. So like Millie said, focus on one or two areas. There's so much to climate, but if you're looking at gender issues, if you're looking at health, narrow it down and then narrow down your 30-second soundbite about your scientific expertise. And we all have the ability to do that, but we can all mentor and coach one another in ways to do that better.
Yes, we all have to stay proactive as a profession and not just reactive. And that's probably some of the hardest parts of doing policy work. So I'll take our first question from the chat. Amanda Doe asks, what does it mean for a country to not be listed in the Bellum Action Plan? So I'll start answering this, but then I'll turn it into a question for our panelists. So at many different UN events and at many different ways that we engage at that global level, governments are making commitments to follow different resolutions. And these commitments are often not held accountable by any sort of legal mechanisms or anything under those lines. So the countries that signed on are those ones that stepped up and said, we are making a commitment to that. However, we know from the Paris Agreement and many other UN agreements that doesn't always mean that countries follow through on the commitments that they made. So maybe what I'll ask for our panelists is how can we all engage with our home countries' governments to educate them about what this Bellum Action Plan is, and make sure that what is happening globally is known and acted on locally. I'll open that up to any panelist who's interested.
I can just quickly give my perspective. To your point, Gil, acting locally while thinking globally is powerful. And so I would say that in this current administration, the Fed looking to the federal isn't necessary. It's more of a barrier than looking to our local policymakers. And so what that would look like is maybe your governors, maybe your mayors, or even your council people, because effective change can look as clear and as tangible as asking your town to invest in things like solar panels, and being able to explain as a nursing professional the importance of renewable energy. And even higher than that, at the governors, why is it important for governors to participate in COP? Because there was a segment of governors, believe it or not, that did go to COP. So do you want your governor to participate? And what demands or requests do you have for them? So I'll leave it at that. Thank you.
Thanks. Would anyone else like to comment on how to get global action to be implemented locally? Go for it.
I would just go back to a theme that we've talked about throughout this talk, and that is voting, using your voice through voting, using your voice through supporting candidates that have climate action on their agenda, and voting for those candidates and supporting those candidates. heard Millie talk about governors. I saw the governor of California, Gavin Newsom, at COP30 in Brazil. And, to me, I don't live in California, but seeing that representation and knowing that that's high on California's agenda was, very inspiring to me to see in action.
Would any other panelists like to comment on that as well? Otherwise, I'll go to the next question.
Yeah, well, no, I just wanted to say, not to turn this into a USA-centric conversation, right? But Senator Whitehouse from Rhode Island was the only U.S. presence from a high-level government perspective, and he came with the same badges that we had as observers because the U.S. was not present at COP. And he said, our president has a fossil fuel agenda, but Americans have a climate crisis action agenda. And so we're still very much engaged in this. So I agree with the other two speakers who said, yes, let's talk to our governors, let's talk to our local politicians, because we do have space there to influence. And if you don't have health, what else matters, right? So say that all the time, like health is a universal that unites us because we all want to have health and be as healthy as we can be. So huge emphasis on that. And our nursing cap, always identify yourself as a nurse in the conversation, make yourself visible, and let people know that nurses have the capacity and agency to contribute to these high-level discussions, because we do. And that beacon, trust me, and and listen to what I have to say.
That's so right, Connie. And Gil, I don't want to just step in here, but I'm seeing so much great engagement in the chat. And I want to open up an opportunity for some of those who are asking these questions to have direct contact with some of our panelists today. So maybe we could go into some breakout sessions for about 10 minutes and you can ask some of these questions directly and really engage with some of our amazing nurses. I want to invite you, we're going to have 3 different breakout rooms that you can choose to go into. Number 1, we'll do getting started in healthcare advocacy. If you're just starting out, please join Millie and Linda in that breakout room. If you want to know more about that local to global, global to local, and implementation of solutions, you can join Kat and Dr. Sue M. Bell. And then if you want to get more specific, asking some questions about the participation in the UN negotiations, you can follow Connie and Kara there. I'll stay here in this main room and I'll also be moderating the chat.
So thank you, everyone. I know the breakout I was in was a really fruitful discussion. We certainly didn't have enough time, but that seems to happen always with breakouts, but really excited for this participation in this event and that discussion. I'm just going to close us out here. As we close this powerful session, I want to reflect on Annie and SunCL's efforts to elevate nursing leadership on climate solutions. Over most recently, through the nurses leading the charge, the path to COP30, we have witnessed nurse leaders step forward, not quietly, but boldly, which is amazing, into the most urgent challenge of our times, the intersection of climate and health. And today's reflections at the session really remind us that progress is not a single moment, it's a continuum. Whether it's getting started in advocacy, translating global commitments into local action, or engaging directly in UN negotiations, each step matters, and each of you have a role to play. So as we look ahead, the momentum cannot stop here. The road beyond COP30 calls for deeper collaboration, continued innovation, and an unwavering commitment to equity and justice. It calls for us to bring back what we've learned to our institutions, our communities, and our systems, and to keep pushing for change. So let this be both a culmination and a catalyst. And I want to leave you with 2 action items as we close. So the first is the SunCL's UN Immersion Program, which is a transformative 2-day program at the heart of the UN headquarters in New York City. It's designed to empower nurses as global health advocates and leaders. In this experience provides a direct engagement with the United Nations ecosystem, global health policy, international nursing innovation, and it's just a really fantastic program. The next cohort will occur over in October 2026 sometime. So we will certainly be sharing additional information, but I would encourage you to go to the QR code so you can sign up to get notifications if that's of interest to you. And I know we're coming up on time, but I just wanted to also share ICN's Nurses for Peace campaign. This is a campaign focused on supporting the courageous and resilient nurses who continue to provide much needed care despite the personal dangers they face in their work. And so I would encourage you to go to the ICN website to learn more about the Nurses for Peace campaign. And learn how you can engage in this really important issue and support our colleagues all over the world who are providing nursing care in the most challenging of environments. And then the work continues and we move forward together. So thank you all for your participation, your leadership, and your efforts to elevate nursing and climate action. Thank you so much.